Welcome, everyone, to Talk to Me podcast. We're going to be talking about mental health. And it's always good if we have the right people to share with us what it takes to understand mental health. And at the same time, be educated on all that it means to know about that. We are privileged and we are honored to have to help us in our discussion Mr. David Yearwood. Welcome, David.
Thanks so much. Thanks for having me.
It's good to have you here, buddy. So, before we start, David, tell us, who is David Yearwood?
Who is David Yearwood? I'm still trying to figure it out. But one of the things I certainly am is a mental health nurse. I've been a nurse for 11 years and mental health, behavioral health, addiction the whole time. I'm fascinated with the world and passionate about helping people in that community.
Wow. So, what is mental health? Because I believe people know what it is, but do they really understand when we use that connotation, that word? Mental health. What do you think about that?
I think that's an important distinction because when people think about physical health, they distinguish between, physical health and physical illness. But sometimes people use the term mental health as just sort of an umbrella for all of it. Like all that stuff over there that I don't understand, that I don't want any part of, and contributes to what we're talking about today. It contributes to a lot of the sort of a stigma and misunderstandings in that world. But we all have mental health in the way that we all have physical health.
Interesting. So then, when we talk about mental health in your explanation, right, then do we have, what are some of the conditions that we may classify as mental health? For example, from the medical point of view, med-surg, whatever point of view, when somebody says, okay, I got abdominal pain, maybe I can have appendicitis, maybe, somebody has PE. So when it comes to mental health, could you share with us a few diagnoses?
Yeah, for sure. A lot of the times we run into folks who struggle with depression. Some people refer to it as clinical depression or major depressive disorder. Generalized anxiety is another big one. Bipolar disorder. People used to refer to that one as manic depressive disorder, folks who have really low lows and really high highs. Those are some of the more common ones that we run into. And under the umbrella of behavioral health is also substance use disorder, addiction, struggles like that. A lot of folks struggle with also suicidal ideation. And that sort of thing falls under our purview as well, like things that we try to help folks with.
Wow. The mental health is a broad area then.
For sure.
Wow. So then, thank you for that, right? So if we to move the needle up a little bit here, so to start, when we talk about mental health stigma, because this is going to be our discussion for today. Mm-hmm. When we talk about mental health stigma, what do we mean by the term stigma?
Well, I think that's an excellent place to start because if that's the word that we're throwing around, I think it's a good idea. I always like to start with just the basic dictionary definition. So the definition of the word stigma is a set of negative and unfair beliefs that a society or group of people have about something. Just a general negative bias or negative view type thing. But I think it's also important to remember not just that sort of basic definition, but where we get that word from. That really hit for me when I started really digging in and researching stigma and trying to address that in my work. Our English word for stigma comes from ancient Latin and Greek roots, and it comes from a time when it referred to placing an actual physical mark on people to signify disgrace.
Ah,
They would use it to mark criminals and slaves
okay.
and things like that. And that really hit for me because in my work in this field and working with individuals who struggle with mental illness and addiction and those types of things, I've seen that same sort of level of disgrace, like not with a physical mark, but that same sort of, what would people think of me if they saw this? What would people think if they knew this about me? And so it leads to a lot of people just sort of suffering in silence because they feel like they can't show that about themselves.
Wow. I like the segue of taking us all the way back to the ancient times, right?
Yeah, yeah.
So when somebody looks at a stigma, it's like your body is being tattooed for whatever reason, right? In those days.
Yeah.
Wow.
And we don't use the physical mark anymore, but,
Right.
but that same level of disgrace is still there.
Wow. So how does stigma affect people living with mental health conditions, right? Maybe, and as well as their families, their relationships, and willingness to seek help. What are your thoughts on that?
Well, it's certainly because of that sort of fear of what are people going to think of me if they knew this, and that knowing that there's a negative view around mental illness and treatments. There's a delay in seeking help, or sometimes people avoid seeking professional help altogether. They're like, well, I'm not going to be viewed like that. And then there's also, it contributes to sort of self-stigma, learned helplessness or hopelessness. Because, you know, if people hear something about themselves often enough, they sometimes start to believe it. So if they hear everybody saying things like, oh, yeah, watch out for those people, they're crazy. Oh, man, I met this bipolar person and they
Right.
were out of their mind. And they're like, oh, well, I guess if that's me, I guess I am crazy. I guess I am hopeless.
Yeah.
I guess I am, what good does it matter even? And that sort of learned helplessness and that sense of hopelessness that comes with just being bombarded with that all the time.
So then it means that stigma kind of, it plays a role in people avoiding or not trying to seek help.
Mm-hmm. Absolutely.
They have it probably, they don't even want to go to the hospital.
Yeah. And you mentioned the impact on families and loved ones. If we need help and we don't get it, then the people around us sort of become our default help. And they're not prepared for that. And that puts a strain on relationships. If I need to see a therapist, and I do, by the way, I have a therapist. And little sidebar, I encourage everybody to have a therapist. But if somebody who would benefit from any sort of mental health treatment and I don't get it through the professionals who are qualified to do that, then it sort of seeps into my relationships and starts to put a real strain on those relationships as well.
Yeah. And you know, I'm originally from Ghana, right?
Mm.
So when we talk about stigma and mental health, it's a big deal out there, where, you know, a family member may have a mental illness, and for whatever reason, because we don't understand, okay, the details of mental health, people are kind of cast out.
Yeah.
Okay. So stigma is a big thing.
It's a very real thing. And like you said, especially in cultures who, for whatever reason, have never been exposed to that or gained any additional education around it. I did community treatment for 5 of my years of my mental health nursing career. And I spoke with somebody who was originally from Ethiopia, young man, and he had a diagnosis of bipolar disorder. And he told me about a time where he was back home visiting with extended family there in Ethiopia, and he had a manic episode, and people took him not to the hospital, to the church, and they tried to like perform an exorcism. He was having mental health symptoms, but in their culture, they were like, oh, when somebody's displaying these signs, we need to take him to the church, and he has some sort of, you know, demonic possession or something that we need to address. And I was like, man, what happened? What'd you do? And he was like, well, after a few hours, one of my aunts was like, maybe we should take him to the hospital. And I was, well, thank God for that aunt who spoke up on your behalf.
Somebody saved the day.
Yeah. But yeah, it's a very real thing. I mean, in America still, but like you said, especially in some other cultures.
Wow, wow. Ladies and gentlemen, so this afternoon we have in our podcast discussion, your host, my name is Daniel Ampoma, and we have here with us our clinical educator for mental health, behavior health, Mr. David Yearwood. So, Dave, as we, dig deep into our discussion about stigma and mental health, why do you think mental health challenges continue to be stigmatized in our society? Again, despite growing awareness and education. And I believe that, education is ongoing. It's been done for years and years, but yes, still, it looks like, I don't know, but that is my thought, that it looks like we're not having a breakthrough. What are your thoughts on that?
Yeah, I mean, there's lots of growth in that area. It's certainly talked about more and talked about in a more positive light now than, 10, 20, 30 years ago, but there's still that lingering impact, that lingering effect. And ironically, even as we sit here talking about how significant the stigma is, right now, mental illness in America anyway is likely the least stigmatized it's ever been, but we still have so much room for improvement. The wheels turn slow when it comes to the education and the culture.
Yeah.
It's funny. It reminds me when I was in school, I remember hearing about, and you may be familiar, there was a story about who they called the father of hand hygiene. There was this doctor in Hungary back in the 1840s, and it was like he was delivering babies, and the maternal fatality rate was really high. And he came up with this idea. It was like, maybe I should wash my hands before I try to deliver a baby. And then it turned out he did some sort of just research. So he started using this substance to really scrub up, and fewer people were dying. So he was like, breakthrough. Hey, doctor friends, let's wash our hands before. But then the other doctors didn't want to. Like even something as basic and now foundational as hand hygiene, it was like the 1980s. People were still like, you think it makes a difference if we wash our hands? And this was, he came up with the idea in the 1840s. Yeah. So here we are talking about mental illness, mental health, and it's like, yeah, we've certainly made progress, but man, we've got a ways to go.
Mm-hmm. So can we also then, say that our own society and the people who make up that society, somebody might say, is it prejudice that comes into this, in looking at stigma? Or is just that people don't want to go by what it is? I don't know.
Yeah, and I'm sure it's sort of pieces of both.
Right.
But yeah, it's a self-perpetuating type thing, So like, I see that over there, I have a negative view of it, so I avoid it. And when education is kind of one of the answers to stigma, the more we avoid, the less educated we are about it. If you're ever around it, when I initially started doing community treatment, I got my nursing license. I started doing working with what they called an ACT team, ACT, assertive community treatment. And so I'm going out into neighborhoods and homes and clinics and things. And I remember in the town where I grew up, where I started this work, I'd hear people talking about, oh, don't go over there to that part of town, or watch out for that guy shuffling down the street talking to himself. That guy's crazy. And so then that guy that they were talking about ended up being a client of ours, Right. And I was like, oh, well, I'll change his name for private. I say, oh, that's just Billy. Mm-hmm. He just needs his medicine. Like he was a guy with a life and a family and a history, just like I was.
Wow.
But as long as people could just see him over there and kind of laugh and avoid him, they could just like, that's a crazy person. And they have this picture of what a crazy person looks like. And I'm like, I've met him. He's just a guy. He's trying to live his life like I am.
He's like a regular person.
Yeah, as we all are. And so that was one of the things. The more people I met, I'd met people I'd never known a lot of people with substance use disorder or addiction. And I met those individuals as well. I was like, oh, they don't want to be addicted. Like, this dude's trying to live his life, and he's come into this situation. The humanity of it, like the education, but also just like seeing people as people and not a sort of caricature of what, quote, crazy looks like. That's a big piece. If we can ever get there, like seeing the human beings around us.
It's like somebody saying we don't want them to be part of the statistics, right? So, David, right? So here, what do you think, in your estimation, could be an end result of stigma if, as a society, okay, as a country, as a nation, if we do not, put our hands around it, we don't manage it the way that would help us out? What do you think are some of the end results of stigma that goes unmanaged? What are your thoughts on that?
It could certainly result in more of that separation, that us over here and them over there. This sort of chasm between us will continue to grow if we don't reach across and say, oh, I'm a person, you're a person. I've got problems too. Like, mine are not the same as yours, but I know what it is to struggle. I know what it is to have a problem. And in some of the research that I've done around stigma in particular, I've talked with people, friends of mine who I know personally, who have received mental health treatment, and asked them, what was it like for you? What has been your experience? Have you experienced stigma? And they all sadly said yes, but some of the examples that they shared with me that I was able to share with folks, I mean, they talked about, I've been looked at differently by doctors and caregivers. I've had a provider tell me I don't look anxious, like just sort of dismissed in that way. Mm-hmm. Somebody said by the looks they give you in the ER, being threatened to be sent to the mental health ward instead of just listening to me about what was going on. The look in their eyes, that was so interesting to me. 3 people I talked to, all 3 said something about the way they were looked at.
Wow.
And that hit for me too, because a lot of times, even well-intentioned people who have that underlying bias or stigma,
right?
They think, what, I didn't say anything. Like, stigma is not necessarily acted out or said out loud. There's some people are like, oh, that's somebody with a stigma. They're the ones who like, oh, get out of here, you crazy person. But they can see it. They can feel it. If it's there, you don't have to say it out loud or act it out for them to know how you feel about them. In the way that, when you and I first met, we knew, oh, we're the same. Like, we got a vibe. We're brothers. We know that. For some reason, we knew that right away.
Exactly right.
People can tell the opposite also. When they go into a situation, they're like, oh, I see how this person feels about me. It's wild how you can tell almost immediately, and they had that same experience, but around their mental illness or around their symptoms. And they felt dismissed or looked down on immediately. It's wild how impactful and immediate that can come across.
Yeah. Wow. So let's bring this to our own profession, right?
Sure.
So I know both of us, we are all nurses. And, nursing is a beautiful thing. And, David, we always talk about nursing, right? We talk about it, and I love it. There's no 2 ways about it. If I go back, would I be a nurse? Absolutely, yes. So what role do healthcare professionals, right, and healthcare systems sometimes play intentionally or unintentionally in reinforcing mental health stigma? So we're bringing this close to home.
Yeah, it's interesting. I love mental health as a specialty because it is a specialty and should be addressed by people specifically educated and trained to address it. However, that separation sometimes keeps people on the other side of having a better understanding, because the more people are around it, the more they can get that, oh, that's just a person, like in the way I learned it early on. So I've had the privilege of like working across the hospital here, and chatting with nurses, providers in other areas, and they're like, or float nurses, for instance. Like there are float nurses who go all across the hospital, and there are some who are like, I don't want them to float me to mental health because it makes me uncomfortable.
They don't want to go to BH, right?
They don't want to be on the behavioral health unit. And on the other hand, there are others who are like, yep, these are my people. I get it. Right. I understand. But that sort of separation, one of the things that we can do better as healthcare providers, as healthcare systems, is making sure there's a better understanding, making sure that there's education around these things, because those misunderstandings are some of the things that perpetuate that stigma, that negative view, that being able, again, to keep us over here and them over there. Like, watch out for them. They're not like us. They are like us. Like, we're all the same. I'm like them. We're all the same. That's that. And I don't know, maybe it's a human thing. It's just human nature that we're just like, I don't know them. I don't like them. I don't understand them. So I'm going to keep them.
Yeah.
And not be us with them.
That's right.
But that separation is part of what's so dangerous.
You just hit it right on the nail, brother.
It's that othering.
Wow. So, Dave, what can healthcare providers, right, community members, organizations, obviously, do to reduce stigma? And above all, create a more supportive environment for people who continue to experience mental health challenges. So we kind of want to look at, in your estimation, what can we do to reduce it? I know sometimes, we talk about these type of conditions, and there is no perfect world where we're going to say, oh, we will 100% eradicate what? Stigmatization?
Yeah.
Now, we are not in a perfect world, but probably we can be in a world where we can reduce it.
For sure.
So what are your thoughts on that?
One of these, and a couple of things I'll say, people listening might be like, well, yeah, like that seems obvious. And I hope that's the case, because I hope people can see that we're not that far removed from a solution. Because one of the first things that comes to mind is seeing individuals as individuals and not as a diagnosis or set of symptoms. Like, that sounds obvious. Like, obviously Mr. Smith is Mr. Smith and not Mr. Bipolar Disorder. But it's very fast-paced in the hospital, and nurses assess. That's part of what nurses do.
Yes,
but
right.
Sometimes our assessment skills can help us jump to conclusions and put people in boxes as well. So if we can eliminate the boxes as much as possible, we can keep a diagnosis, but not also in my mind think, oh, because they have this diagnosis, they must go in this box because all people with that diagnosis fit over here. But try our best to see individuals as individuals. Recognize that people with a mental health diagnosis are not better or worse or necessarily even that different from people without. And another thing that we can do is just have conversations like these, educate ourselves, expose ourselves to new information about people or about a diagnosis that I don't understand. And, I mentioned bipolar disorder a couple of times. It's like, for people who are experiencing mania, or having a manic episode, which is what happens when people with that diagnosis really get ramped up and symptomatic. People might see somebody like that and they are acting abnormally, as you would, because everything in their body and mind are kind of ramped up at the time. But it's so easy for somebody who's never experienced that before to see that person and put them in that box and other them. Like, oh, I see what they are. I'm not like that.
Yeah.
The other side is sometimes we'll become dismissive of people who struggle with things like anxiety and depression, because somebody with like clinical depression, major depressive disorder level depression, somebody who has had depression but not to that level before, they'll be like, it's just being depressed. Just snap out of it. Just go for a walk. Or somebody with an actual anxiety disorder, panic attacks and things. All of us have experienced being anxious before, so sometimes we'll be like, what? Just handle it. Snap out of it. I've been anxious. You've been anxious. They're just anxious. And so then we end up with that sort of, I call them the just people in our lives.
Just people, right? Okay.
They'll somebody with like clinical depression, they'll say, just go for a walk. Just take a shower. Why don't you just, and whatever comes after the just is almost never helpful and sometimes hurtful. So in answer to the question, what can we do? Let's try to keep those judgments out. Let's try to not be, well, they're way over there, different from me, or let's also not be dismissive of what people are going through. See the individual, see the human being, recognize the commonalities between me and them. It's not that I'm normal, they're not. It's we're all human beings. I don't personally have diabetes, for instance, but I can hang out with somebody who does. I can.
Right. Yeah.
I don't have asthma, but I know. But I've been short of breath. Like there are commonalities. There
That's
are
right.
these big chasms that we keep between us and people with a mental health diagnosis are not necessary.
Yeah.
Not helpful.
So David, I remember, right? Back to this same question.
Sure.
Kind of looking at creating an environment where you make, let me put it this way, you kind of make the environment very conducive, not judgmental,
Mm-hmm.
and you make people feel very, very comfortable, okay?
Yeah.
For them to feel who they are and to share, what is within them
Mm-hmm.
clearly and get help without being like a third eye looking at them and say, you are this or you are that. I believe a couple of weeks or months ago, I watched you do a presentation, and the way and manner you spoke, okay,
Mm-hmm.
you were honest, frank, non-judgmental, and the environment was very comfortable, okay?
Yeah.
For everyone to feel that nobody is looking on my shoulders, so I can speak out. So I really appreciate, especially you talking about this question on, somebody might say, as healthcare providers, what can we do to reduce?
Sure.
And for me, this is my own personal experience. When I heard you speak, that was what you were doing right there.
Oh, nice.
Making the environment what? Comfortable.
Right.
Okay. Because people have so many ways in which they can help.
Yeah.
And I believe that one of your ways of making things happen is that you make the environment what? Just comfortable and non-what? Judgmental.
Oh man, that's so kind of you to say, and such a compliment, because that's part of what I hope to do. If I'm helping somebody, connecting with them is the first intervention. Whatever comes next,
That's right.
and allowing for that environment or the vibe between us to be conducive. And I love too that you were like, there was no judgment there. Judgment is such a partner of stigma and such an enemy of individualized care, in my opinion. So the more I can do to keep that out, the better. One of the greatest compliments I got from a patient, I was working at a residential detox facility, and there was this guy who was there. His substance of choice had been, before coming to treatment, cocaine. And he had stayed, he had done the thing, and I had built some relationship with him while he was there. And on his last day, we were saying our goodbyes, and he was encouraged. He was like, when I get a little time with my sobriety, I want to come back and talk to the people here. I really think it's important for me to be able to, for people to hear from people who have been there, and I want to help people in that way. And I told him that's one of the reasons I feel so blessed to be able to connect with people in different settings like that. I said, I've not ever experienced substance use disorder. I've had loads of my own problems, just not that one. And the compliment was, he said, see, that surprises me. Like, I was able to connect with you on such a personal level about this. I didn't want to ask you because that would have been a personal question, but I just assumed if I did ask you, you would have been like, yeah, I used to use, I'm 10 years sober. Like, we were able to connect in that way simply because I had not judged him. I don't have this thing in my head for whatever reason where I'm like, cocaine? What kind of person would use cocaine? The same kind of person as me.
Exactly.
I haven't, but I'm not above it. Yeah. There's not this, again, I talk about this chasm between us. It's not, I had a person I used to see in the community tell me he was just anxious all the time. And I was like, what is it you want, And he said, I want to be like you. And I said, easy, man.
Easy, man.
Shoot higher than that. I'm like, I'm not better than you. It's not I'm here with the answers and you're here with the problems. I mean, I'm a human being just like you are. Like, I know he meant like I want a steady job and a family and stuff like that, but I'm like, don't aim for this. Like, just aim for being the best you can be. That's all I'm doing. We're all works in progress, So I don't know what it is that was put in me to not bring that judgment into interactions. But man, I'm thankful for it because it has allowed me such impactful relationships in both directions. Like, people say that I've been able to help them, but I've benefited from those interactions as well.
Right. Oh, ladies and gentlemen, I wish, we could just, David, something, we can just go on and on and on because this is just a wonderful, presentation and discussion. Mm-hmm. I mean, like I said, we can go on because you have a lot that you can provide. You have a lot to give to the community. And we will have you back.
You know me, I could talk about it forever.
We will have you back. So, ladies and gentlemen, we all want to thank you so much for being part and parcel of today's discussion on our Tell Me podcast. And our discussion for today, we were looking at mental health stigma. And we had no other person to come in and help us out. We had Mr. David Yearwood. He's the clinical nurse educator over here at Inova Mount Vernon Hospital in Virginia, obviously. So, David, before we wrap up, so if there is one misconception about mental health that you wish the public would let go of, what would that be?
That is such a good question, in part because it forces somebody who could talk about this just as a broad topic from now till forever to bring it home to one point. So here's the point that comes to mind for me. I feel like a lot of times people don't seem to have an issue with viewing physical health sort of on a spectrum. Like, I'm not bedridden and I'm not an Olympic athlete. I'm somewhere between those extremes, like most people are. But when it comes to mental health, people don't view it that way. People often view it as very black and white. Like, these people are sick and these people are well, or these people are crazy and these people are normal. So that would be, if I were to narrow it to one, I think that misconception would be one that I wish we could address. Like, our mental health is more similar to our physical health than people realize. And I think it's more on a spectrum like that, just like our physical health. And in that same way, people don't seem to take issue with working on their physical health. Like people all the time, they're like, I'm going for a walk, or I'm watching what I eat, or I'm drinking some water today. Like they do these things because they recognize that physical health is a thing that can be improved upon or worked on. Even if they have a diagnosis, they're like, I have heart disease, I have diabetes, I have whatever.
Yeah.
They recognize, oh, if I hit the gym, if I watch what I eat, if I get good sleep, if I stay hydrated, those sorts of things. But mental health, they're like, those people, what are you going to do? They're crazy. And they don't recognize, oh, there are things that I can do. There are things that I can do to address my mental health and work on that in the same way that there are things I can do to address my physical health.
Wow. Again, David, thank you for coming.
Absolutely.
Today, we really appreciate your insight and the knowledge that you bring to, bear, especially when it comes to looking at mental health illness and the stigma that comes with it. It is my hope and my belief that you've really reached out to our audience today, and we've learned.
Absolutely.
We've learned.
I certainly appreciate the opportunity. I appreciate you, my friend.
Yeah, we've really learned. So to everybody who is out there, thank you for joining us, and we will wrap up our discussion for today. And as you are all aware, this is Talk to Me podcast. Your host, I'm Daniel Ampoma, and we have today Mr. David Yearwood. You all have a wonderful day.